Now we will learn histology of the suprarenal gland. Histology of suprarenal gland. These are two glands which lies over the kidney. This is the right kidney, this is the left kidney. The right kidney, the suprarenal gland is triangular, whereas the in left kidney it is semilunar in shape. If we take the cross section of this suprarenal gland, what will we see? That this is outer zone is cortex and the inner zone is medulla. It is yellow in color, and this is brown in color. Yellow due to fat deposits, due to presence of fat. Now when we look into the detail of this cortex and medulla, these two are different from their structure, function and development wise. A structure, that the cortex is made up of three layers, that is GFRs, the zona glomerulosa, zona fasciculata and zona reticularis, whereas the medulla is one in which they secrete. I will discuss what is the differences and the function. It secretes the glucocorticoids, sex hormone, and this secretes the epinephrine, norepinephrine. Development wise, that the cortex is developed from the coelomic epithelial cell of the posterior abdominal wall, that is mesodermal in origin. Whereas the medulla is developed from the ectoderm, that is from neural crest cell. Okay. Now coming to the histology in detail, that is here is the first, there is capsule, beneath which there is subcapsular plexus, arterial plexus. Now we have to know something about the arterial supply of the, for knowing this arterial plexus. This is our abdominal aorta, this is the renal artery, and this is the inferior phrenic artery going to the diaphragm. And so the suprarenal gland, which lies here, it is supplied by the inferior phrenic artery, and from the abdominal aorta, the middle suprarenal artery, and the inferior suprarenal artery is from the renal artery. Okay. And about the renal vein, the renal vein, it is drained into in the right side to the inferior vena cava. Suppose this is the inferior vena cava. Okay. And the suprarenal gland drain into in the right side to the inferior vena cava directly, and in the left side to the left renal vein. Now coming to the arterial supply, this artery they are making, and here it is, suprarenal gland is enveloped within a capsule. There within a capsule it forms the subcapsular plexus. Okay, within a capsule this artery forms subcapsular plexus. Now they differentiated into two type of artery, that artery of cortex and this is artery of medulla. First lies the cortex and then medulla. So artery of cortex, they differentiated into many capillaries network, and this is the artery of cortex, and this is artery of medulla. It runs up to the medulla and then it differentiate into many capillaries, okay, in order to supply medulla. And these arteries, these capillaries of the cortex, now it come up to the here medulla, and then it drain into by the venule, it drain into the medullary capillaries. These are the medullary capillaries, and these cortical capillaries by the medullary vein, they drain into the medullary capillary. This is the cortical veins. The cortical capillaries, and these are the cortical veins, drain into the medullary capillary system. And now they are forming the central vein. They are forming central vein, and this opens into what I have told earlier, that in the right side directly into the inferior vena cava, and the left side. So this is the capillary system inside the blood circulation. Always ask what about the blood supply of the suprarenal gland. So this way, because the artery, this cortex bathed within the but within the artery or capillary system of the cortex, where is the medulla, bathed within both the capillaries of the medulla as well as the venous blood coming from the cortical part, which carries the cortisol, mineralocorticoids, and the sex hormone. Okay, and in the presence of the glucocorticoids, they secrete the medulla secrete epinephrine and norepinephrine. So it is of very, very great value. Now coming to the histology proper, that this is the capsule beneath which there is subcapsular plexus, and now this is whole, or this is cortex, and 1/5 is the zona glomerulosa, GFR, and 3/5 is the zona fasciculata, and 1/5 is again, this is 1/5, this is 3/5, and this is 1/5. Okay, zona fasciculata, zona reticularis. In the zona glomerulosa, there is inverted U-shaped columnar to polyhedral cell. Okay, there is columnar to polyhedral cell arranged in inverted U pattern, and in between this there is sinusoids. Okay, and this cell contain, these are the nuclei and also some fat droplets, but not so much, few fat droplets. Okay, and this is the highly acidophilic cytoplasm. Okay, acidophilic cytoplasm. So first inverted U pattern columnar or polyhedral cell arrangement. Okay, first. Second is it contain pronounced nuclei with acidophilic cytoplasm, and third is the few fat droplet. Okay, and within which, in between this U, these are the sinusoids. Okay, now coming to the zona fasciculata. In this, again there is polygonal cell, polygonal or round cell arranged in a cord, vertical cord like fashion. It is 1 or 2 cell thick. This is 1 cell thick, this is 1 cell, and this is 2 cell thick. Vertical, but arranged in a vertical cord like pattern, and in between these cords there is the long vertical sinusoids are there in between these two. These are not so long here, the sinusoids, but here in the zona fasciculata the sinusoids are very long, and these are the polyhedral cell, polyhedral or polygonal round, okay, type of cell arranged in a cord, and there is many fat droplets within it, many fat droplet. So that's why these are also known as spongiocyte. So what are the specific about the zona fasciculata? Arranged in cord, 1 to 2 cell layer thick. Second, in between cord there are vertically arranged long sinusoids. Okay. And third is full of this polyhedral cell or polygonal cell, they are full of fat droplets, so called spongiocyte. Okay. Now coming to zona reticulosa. Name itself says it is in reticular pattern. So there is anastomosing cord like pattern. Anastomosing cord. It creates 1/5, and here is the cells are small. Their cells are small and they are branching and anastomosing cord. Arranged in branching and anastomosing cord like pattern. Zona reticulosa. This upper one secrete aldosterone. It secrete mineralocorticoids, which is example is aldosterone. Here it secrete glucocorticoids, which is cortisol, cortisone, like this. And the zona reticulosa it secretes sex hormone, that is the androgen. Okay. This mineralocorticoids is, it does sodium hydrogen balance, water and electrolyte balance via the aldosterone through the distal convoluted tubule. It does sodium water electrolyte balance by distal convoluted tubule, as well as the striated duct of the salivary gland. Okay. And this glucocorticoids, the cortisol, it help in the protein, fat and carbohydrate metabolism. And sex hormone, it are the androgen. If this is in excess in female child, it will cause the male like features, and if excess in male, it will cause precocious puberty. Okay. So now coming to the medullary region, here the cells are brown in color due to the presence of the cells are filled with brown granules, and these granules are the precursor of epinephrine and norepinephrine. And these brown cells are known as pheochromocytes. These cells which is full of brown granules, these are known as pheochromocytes or chromaffin cell. Chromaffin cell. This cell is supposed to be the modified sympathetic post-ganglionic cell. Okay. Post-ganglionic cell, which is innervated by preganglionic sympathetic. Actually, the adrenal medulla is the part of the sympathetic ganglia. Sympathetic ganglia, it at the level of the during the development as 18 to as 24, it convert into the adrenal medulla. So that region sympathetic ganglia, they are supplying by the preganglionic sympathetic, and from there the post-ganglionic sympathetic arises. So it is the modified post-ganglionic sympathetic which has lost its axon and dendrons, and the preganglionic are coming to innervate. Rest of the organ in our body is supplied by the post-ganglionic sympathetic, but this is the only organ which is supplied by the preganglionic sympathetic, because it itself is a post-ganglionic sympathetic neuron who has lost his axon and dendron. They are the sympathetic ganglia. They are the part of the sympathetic ganglia which insert within the adrenal cortex, and that is called the adrenal medulla. Okay. So these pheochromocytes are nothing but the modified sympathetic post-ganglion, and they are supplied by preganglionic sympathetic. Okay. And there are, and there is also, if you look into the microanatomy of this medulla, there is also ganglion cells. These are the pheochromocytes, and in between there are also ganglion cell. These are also polyhedral cells. Okay, so ganglion cell, these are nothing but the post-ganglionic parasympathetic. Post-ganglionic parasympathetic neurons, which are known as post-ganglionic parasympathetic ganglia. Their ganglia regarding the parasympathetic is what they are coming, and they in within the organ there is they are the ganglia are situated. So this is not pre and post. These are the parasympathetic ganglia. Okay, the ganglion cell within the chromaffin cells, which are the modified sympathetic post-ganglionic. There are also ganglion cell, which is parasympathetic ganglion. Okay, every organ is supplied by sympathetic as well as parasympathetic. So it is parasympathetic and this is sympathetic. Okay, and now in the presence of the cortisol, which comes into the blood circulation within the medulla, they secrete epinephrine and norepinephrine, and these are the emergency hormone. Okay, we can live without adrenal medulla, but we can't live without adrenal cortex. This is essential for our life, but this is not so essential. It can be compensated, but if it is not there, we have to take it from outside through the injections somehow. Okay, now what other, the one thing more, that is here the secretions are expelled in the sinusoids, that is the nearby the blood circulation, as the secretory granules. But here is not, these products are not by the secretory granules. When needed they form and then secrete. जैसे खाना घर में कैसे खाना बनता है और परोस दिया जाता है, वैसा वाला काम हो रहा है यहाँ पे. पैकेजिंग सिस्टम है, सिक्रेटरी ग्रैन्यूल्स तैयार रहता है, जब डिमांड होता है तो फिर पैकेट सप्लाई कर दिया जाता है. दिस इज़ लाइक होटल, जो कि हमारे लाइफ के लिए एसेंशियल नहीं, लेकिन किचन हमारे लाइफ के लिए बहुत एसेंशियल होता है. ठीक है, उसमें खाना बना परोसा. So this is about the histology of the suprarenal gland. Thank you.